It's normal to think about UTI if a patient comes in with fever, malaise, or chills, but anytime a question stem starts telling you on digital rectal examination there's marked tenderness, especially anteriorly, you want to start thinking about acute bacterial prostatitis. And this can happen in young or middle-aged men. It's usually because of E. coli as the primary pathogen, and it's also because you have intraprostatic reflux of urine to your prostate from the urethra that was contaminated. They can even have back pain or myalgias. They look like they just had the flu. And don't forget, they can definitely present with UTI-like symptoms. They have dysuria, frequency, they have pelvic suprapubic pain. And the diagnosis, again, is confirmed because of that digital rectal examination. You would normally treat these patients with 6 weeks of TMP-SMX or levofloxacin, basically depending on the urine culture sensitivities. And you really want to eradicate this infection right off the bat. You really don't want this to lead to complications down the line. It can become chronic and it can cause abscesses. And just as a reminder, TMP-SMX is trimethoprim sulfamethoxazole. If you're thinking that step 2 will not tell you that the patient's prostatic exam is tender because it's too obvious, well, you're right. So you want to look for anything in the question stem that really is talking about some type of prostatic edema or even tenderness, not necessarily during the digital exam. You can start thinking about acute cystitis or even acute urethritis, but remember that the formal usually reveals some type of costovertebral tenderness, and the latter really has dysuria and urethral discharge as the primary complaints. And again, prostatic pain and swelling are not typically seen.